Health Without Borders, because I think it's extremely important for public health. We in public health have to think in systems and not separating out. We have the finest task to see that things are interconnected. We cannot deal with one issue after the other. And I think that in terms of grassroots, a lot of grassroots understand that. They understand that they are working into a group of people that is connected to the environment in which they live, and the environment, the social political environment determines their health. So this is, I think, typically and importantly public health, and more so global health, because we have seen that if we touch one point here, let's say we want to work on one single issue, it will change a whole thing in the system. And all good grassroots that I know understand that. There are other things that are not able to do so. I think of the clinical medicine, they have to focus on the individual, whereas we have to work on the person as part of a population. And that's why we, with the World Federation, sometimes do not use the word public health, but we say public's health, to make sure it's our health all together. So around the world, there are a lot of good grassroots activities, a lot of them run by women, that help. Things like clean water, things like better economy, things like getting children to school. And here we are already in the system. Education, clean water, clean air. It is something that helps everyone else around the single person. And I think probably Alex has something to add there.
Yes, so I think going off what Bettina said, Health Without Borders is hugely important for bringing people together. And as Bettina said as well, we are all humans. We all share the same needs. We all share the same wants. The want to have security, the want to have a good health, the want to have a bright future and hopeful future, and not just for ourselves, but also the future generations ahead of us. And I think that's why it's so important to consider the systems not as silos, but across the different disciplines. And I think one of the sort of going off what Bettina was saying about grassroots initiatives, we see this a lot, as I say, in hospitals where traditionally people are treated by the specialty. So you go into A&E, you get seen by the A&E doctor, who then decides that you're in the medical bit, and then you get seen by medical doctors who then decide that you're actually under cardiology, and you get bounced around between different people. And as an individual, you feel that different parts of your body are being treated rather than you as a whole are being treated. And we know that that's not actually how people actually think of themselves. We think of ourselves as a whole, not as an arm or a leg or a specific organ. So I think one of the sort of grassroots ideas that I wanted to bring up was a group that I had worked with in one of my previous hospitals, where we worked with people who injected drugs, who have quite complex medical histories, but also very closely tied in with the social aspects and the social environments in which they lived. And we wanted to acknowledge that. We want to acknowledge that people's health don't just exist, as I said, as an arm or leg, that exists as a whole. And so we created a integrated team, which included doctors, as well as social workers, as well as people who could bridge the hospital, in-hospital care and out-of-hospital care, and who could follow patients across different hospital admissions again, with that recognition that we as humans, we're not just parts, we are a whole. And that's just one idea that's in one of the hospitals that I've been working with, and we've seen it sort of seeded across other hospitals. But it's this idea of grassroots comes up from the bottom. These are needs that were identified by people who are both needing the needs, but also those who are part of that system and part of that system of helping. And so, yeah, it's interesting to see how these interventions come about.
I think that inequity starts with singling out groups by talking about those and the others. And we learn to think in groups and categories. That's what we are told in school. This is that and that is that. And I think it helps in a certain way, but it is very important to see when categories become creating power imbalances, creating groups that do not participate. And it is interesting to mention that the grouping of people is very deleterious to health, to global health. We have all these categories in mind, and I try to not use them. For example, the global north, the global south, what is that? The black and the white, the female and the male. It's all wrong. We know, and here we speak as biologically trained medical doctors, the individual is never it never fits the group. It's always a bit different. So how can we manage to get the individual and the individual's right, but think of the group as all together? How can we create togetherness? And there we come into politics, because some political systems use groupings to gain power or keep their power. You know, they will sell solidarity for those, but not the others. We will be with you, but not with the migrants. We will be with the good girls who do not do abortion, but with the bad ones. And you know that this is something we have to act against. We have to clearly also define it and recognize when it happens. When groupings start to be dangerous, when groupings start to be dangerous for democracy, for the peaceful living together, then they are dangerous for health, they are dangerous for democracy, for open societies, and they should be really taken up by public health, global health people, because global health people need an open society. They need the recognition of all groups. Even if the groupings were important for some reasons, we have to underline the togetherness all the time. And that's how I think we can work against inequity in all our places, make sure we are not negatively singling out people of some group. Alex, I'm thinking you have already your mind turning.
Yes, so I think, again, going off what Bettina says, groupings are helpful, but at the end of the day, I think it's important to find that common humanity, that common link that brings us all together. And the idea that inequality isn't just a one group or one person's issue, it's an issue for across society. And to find that strength is to recognize that all of us in some way are held back by a system that isn't beneficial for all, and to find, again, that common ground of saying, you know, equality helps everybody. It doesn't just help you, it doesn't just help me, it helps all of us. And because we're in that same boat together, let's work together, let's collaborate together to push back against systems that aren't working for us. And I think one of the biggest things is finding your allies. So if you're finding that's political pushback, finding the people who are willing to stand with you and willing to stand together and breaking down the barriers between your groups. Yes, so I think one of the undervalued systems that I think we should be investing in more is health literacy and general understanding of scientific literacy and, again, health literacy within populations. And why I say this is because we're very much in an era of misinformation and disinformation online. And there are both actors who are acting badly to push misinformation, but there's also people who genuinely think that what is being spouted out as truth or facts aren't actually so. And I think it's really important that we give people the tools to be able to break that down so that we as health professionals aren't trying to fight the misinformation whilst also producing new information. We're not just here reactively spending our resources reactively fighting against misinformation, disinformation. We already have a toolkit which includes public resilience to misinformation, disinformation that we can use, to benefit everybody. There is a need and there is a want, again, in our populations for better health information. So I think as healthcare professionals, we also have a duty to help meet people where they're at, and to, again, raise that general level of health literacy. Because if we don't do it, other actors who have other interests in mind, who want to sell other products, will jump into that space instead. And we end up having to fight them again, rather than creating that preventative resilience barrier.
Yeah, I think it's very true. In addition to education knowledge, sustainability also means sustainability of good governance and good political systems. And they will again help to get the environment and the future possibility of good living on the planet we have. I think it's also a sustainability issue, especially an ask to my generation. We profited a lot from existing, and we have to really take care now of getting sustainable conditions everywhere. And if I say sustainable conditions, it's the environment, it's the living together, it's the education, as Alex said, get the right information, get health literacy, but also get health diplomacy further to political levels so that they are enabled to act for a sustainable next generation living. Because definitely we're talking about our human lives, and this includes all these parts. So I think it's especially a task for my elder generation to be aware and to do all what we have, or to put all our forces into a continuity that is good for all. I just mentioned the word health diplomacy. You know, a lot of things we see today in our world is power play. It's just simple, rude, terrible, aggressive power play. And we have to move away from the paradigm of power and the one leader and the one man organizing it. We finally have to recognize that the tasks in front of us are too complex to be solved by the one single strong man. The power play behind things that happen in front of our eyes are sometimes not good, because they have this other paradigm of ruling, and we have, especially we with our public health voice, to replace ruling by collaborating and assisting. I think this is something we can bring in, and I hope we bring it in also in the topics of the Congress where we talk about geopolitics, where we talk about conflicts and how to solve conflicts in a nicer way than the ruler and the one gets it all. This is not human. This is definitely not human. And we also have to move away from the charity style of health. We have to make it every person's business. So there are many ways of doing it. I would say at the local level, the health diplomacy can be working at every level, but we clearly have to put it at the highest political level. We will be going to the UN General Assembly soon, and we have to put health in there, because just right now we see that health is dismantled in a lot of places, attacked even. So I think we have to do a lot just right now.
Yeah, I completely agree with Bettina. And I'd also add to that the power imbalances of knowledge generation and how who we're listening to, and who we're giving credit to and who we're giving that power to. And I think a big part of that, and I think one of the strengths of having our Congress in Southern Africa is to focus on African knowledge generation. Because unfortunately, we're still seeing, as Bettina was saying, that one man, that one person that we're giving all our credit to in academic papers. We always have a first name author and a last name author, and everyone in the middle gets lost. And I think that's a system that we really need to change, because actually, when we're doing all these big studies, when we're doing all these knowledge generations that cross borders, it's not just the one or two people who are doing all the work, it's everybody involved. And especially when we're looking into the African setting, we're unfortunately still seeing these cyclical power plays of research not being conducted or led, supposedly, by people in the African continent. The agenda is not necessarily being set sometimes in the African continent. And therefore, the grant funding and the money and the prestige doesn't go to those universities and those settings. There's massive imbalances in knowledge generation. And I think we really need to address that. We need to address who we're listening to, who we're giving credit to. We're still in a system of colonial knowledge generation. We're still in a system where it's high-income countries are setting the agenda for what middle and low-income countries should be looking at or should be targeting. We're not always listening to the people who are actually on the ground, working with populations. And we're not listening to Indigenous voices as much. And we have created a system where we systematically devalue, or they have previously devalued, Indigenous knowledge. And really, I think we need to upturn that. We need to recognize that that within the population, people know the answers already. We just need to listen to them. And so I think a practical thing, for example, that we could do is really look at how we're giving credit to academic knowledge, how we're giving credit to authorship, how we're going about creating equitable partnerships. Are they truly equitable, or are they just another way of extending that colonial power system and keeping those powers within an outdated system that actually causes inequity?
Thank you, Alex. I would also add that if in a practical term now, what can we do? A danger for more inequity is the fancying about AI. For all AI now, it covers the knowledge of maximum 20% of the world population. It is mainly based Western, Northwestern, white male. A lot of female knowledge is just absent and will continue to be absent if we go in these algorithms. A lot of knowledge of indigenous people, of people in other continents is not taken up. And knowledge that is produced in languages that are not so common is completely dismissed. So I see a danger there that we will have a closed circle that is a reference for everyone. And this is even more powerful in creating inequity than what we did until now, for example, in our academic system. Because if this is the only knowledge that turns, then we have a real serious problem. And we have seen it in health already. We are trying to pick up now on the fact that women bodies are different. We are starting to see that differences in people's, Asian or so are there, but the AI system that we are running now is not open. And so it will be a danger, and we have to work there for creating more inequity that is worldwide. Just a little add on what you said correctly, Alex.
May I also add on to that a little bit as well? I'd also add it's not just the knowledge that we're using, which is already inequitable, but it's the people who are creating the AI systems, because they are still hugely complicated systems. And unfortunately, the main language that is used to create these systems is English, which means that we're excluding a lot of people around the world who could potentially be part of actually making the system from scratch, who can actually embed equitable practices from the beginning. They're not even in the room when AI is being created or generated. And so we end up as, again, public health bodies and civil societies trying to fight back on a system that's already had inequalities and biases built into it. We're trying to reverse engineer everything when actually we should be, or at least people who, a diverse number of people should be in the room right from the beginning of when we're actually creating these systems.
I just jump on it because we at the World Federation have been following the whole pandemic process, and we will continue to follow the implementation process. I think it is important to have a global view on what we will do with the next pandemic. It's extremely important. We were not good at the COVID pandemic, simply said it like this. And then there is one part that we have to integrate more in public health, and that is laws, international regulations, and how they can help us get health. So one of the subtopics in the Congress in South Africa will be about treaties, international law, health law, and how this could help and foster a stable response to a coming disaster. There may be others. We include others than pandemics. We include disasters, natural disasters, and there has to be agreement. And agreement has to be made before the disaster comes. I always say the firemen will not discuss the pipe they use during the fire is already running. We have to make it before. And that's very difficult because people tend and like to forget a disaster. And we as public health have to push and say, come on, we need a regulation. We have seen how useful the Framework Convention on Tobacco, signed by all 194 member countries, has been. So please, come on, back again on the table now. We need regulations. We need agreements. We need multilateralism. Even if some places in this world think that they can make it alone and on their own, it's impossible. It's just impossible. So my voice here, and will be as well at the Congress, is also talk to the lawyers, talk to the international agreement people, talk to diplomats, and we need that more than ever. please call for multilateralism.
Yeah, I completely echo what Bettina's saying. I think it's not just something that us as public health bodies need to do. It's something that we as a humanity, as a world, need to be tackling together. And I think it's so important that we're engaging, and not just governments, but also private bodies and private equity, that we recognize there are certain goods which need to be distributed equally for the benefit of everybody. Because at the end of the day, COVID spreads because we have gaps, and there are, even if what we saw was, even if one country went into lockdown, if the rest of the world wasn't in lockdown, then that was detrimental to the one country that's done something. So as Bettina says, we can't just think of it as one state, one person tries to look after themselves. We have to recognize that we have to be in it together. And what we saw with COVID was we had very good legal frameworks for the testing of the vaccines. We had very good legal frameworks for making sure that our research was conducted accordingly. But we didn't have very good legal frameworks for making sure that the people who actually needed the end products got the end products. And we saw huge inequities with, again, countries like in the African nations versus countries in the European nations, where there was a massive inequity in vaccine distribution, who was getting the vaccine, how often the vaccine was being given as well. And so we really need to be sitting down together and highlighting that if we have issues in one part of the world, we are so interconnected now, it's going to cause issues in another part of the world. We can't just pretend that half the world doesn't exist, essentially. We have to come together. Again, even if that means creating legal frameworks, creating political frameworks that actually have consequences attached to them as well.
If we think back to the report of Michael Marmot on these kinds, healthy future generation, it is all said. We know that health is dependent on an equal distribution. And what we said just about pandemics underlines it very well. We only can be healthy altogether if there is a kind of equal distribution. It doesn't mean that, and that sometimes if I talk to people outside our sector, that they say, but yes, but health of people is different and people are different. It's not the individual health, but it is the health for all of us that can only be there if we are into it together. I think the COVID pandemic was the best teaching ever. And our learning case is now perhaps drop the word and replace it. Replace it perhaps by stop the power plays, or by something stronger, by something that talks more about what it is. Equal distribution means also a balance of power. Why didn't some countries not get vaccines? Why did others hoard them? This is, I think, perhaps we should think would be a good session in the upcoming Congress about how to replace the word that has become a little bit empty for some, how to replace it, what to say instead. I would like to propose replace it by stop the power plays and get people healthy.
I think one of the biggest myths about health equity that I've noticed is the idea that equity is only for one group of people, or it's only for one defined group of people. And I think it's a myth, because actually I think equity and fighting health equity is for everybody. And I really want to quote the Australian Indigenous elder and philosopher Lilia Watson here, because she says, if you've come here to help me, you're wasting your time. But if you've come here to help me because your liberation is bound up with mine, then let us work together. And I think that's a huge statement to say that we can't just, again, think of people as groups. We can't just think of, okay, I'm here because I want to either help you, or like, your problem is your problem, it's not my problem. Actually, all our problems are interlinked. All our problems need to be worked through together. And yeah, we need to break down those barriers of us versus them. And we need to recognize, again, that common humanity between us and the common goals that we're wanting to reach together. So yeah, so my big myth is health equity is someone else's problem. It's not someone else's problem. It's everybody's problem.
We have talked about the power dynamics. And the question about institutions, I like them very much, because institutions are part of the power system. Let me simply give you an example. We in global health work a lot with UN organizations, mainly WHO, but also others. And what we have seen is that even inside UN and inside UN documents, there is for example, now a pushback on women's rights. They are taking out words of documents at the demand of some countries. So institutions have to be surveyed regularly. We have a group of pushback on women's rights at the UN, because institutions can be extremely important in a positive way. They are necessary, but we always have to look at them and see what they really do, and if they really distribute decision-making power, or do they concentrate decision-making power? That could be the case as well. So I think our eyes have to be wide open on our governance systems, our institutions as well. Our countries, a lot of our countries, for example, have national health institutes. We are working with their umbrella organization, YAMFI. But what is the National Institute in the US doing now? I think everything comes under scrutiny when we want to see that the important equitable distribution remains or increases equitable, and comes not, as nicely said by the indigenous voice, here I help you, the poor, and no, we go together, because institutions play a very important role there, as do our political systems. So yeah, I think we always have to stay awake and make sure that the starting of shifting is stopped at the very beginning. If this shifting is gone too far, it will be very, very difficult to stop something that goes into disbalance.
Yes, and as Bettina was saying, I do think we've touched on this a wee bit already in terms of who is in the institutions, and who's in the room at what points we're making these decisions as well. And I think this is when you ask how do we move away from sort of token inclusivity to actual change, I think that change happens when you have diversity in the room at the beginning of the conversation, and not just at the end when we're trying to reverse engineer, when we're trying to make this policy look palatable to different people in different groups. No, we need to make sure that we have equity embedded in our policies, in our decision making, in our institutions right from the beginning. And I think if that means asking uncomfortable questions and actually being reflective and reflexive about us as individuals, about us as institutions, I think we need to go through that process. It could be uncomfortable. It could upset ourselves, people, cause a lot of, could bring up feelings of guilt, can bring up feelings of anger, and negative feelings that we don't really like addressing and thinking about. But I think these are ideas and these are thoughts that we have to look in the face and actually be honest and accountable for. I think I'm going to give credit to, well, I give a lot of credit to the climate change scene, because I think this is an area which has been so youth led, and it's been hugely disruptive as well as to what young people and the power that young people can have on the system. And I'll point to a couple of years ago when we had the school strikes, and this is obviously prior to COVID, but it was such a it was such a disruptive idea because no one's ever thought about children actively deciding not to go to school. You know, we thought about workers like not contributing to a company, but we've not. It wasn't an idea, it wasn't a concept that children wouldn't turn up to school. But it makes sense because at the end of the day, the climate is about our future generations' health and our own health just now. And I found that was hugely inspirational because it's young people are sometimes a population where we don't think we have power, or we don't think we have much of a voice until we become XYZ, until we get a title. But actually, no, it was showing that no, we do have power right from the offset. We can cause a scene. We can make people pay attention to us. And I think it was hugely powerful in concentrating on the climate crisis and on concentrating what we actually need from society and from governments. So credit to the climate activists.
Yeah. Well, as a person of the other generation, I would add indeed, it is, you said, people who said, we are not entitled, we are young, but all important social changes have been made by people who were not entitled. Women got the right to vote because they went out in the streets. If they were not entitled to do so, they should stay at home. Even in Switzerland in 1993, we got the right to vote. But this was not, it was because, and think of the Black people in the US or otherwise, they got their civic rights because they went out and they were not entitled. So sometimes, or a lot of important social movements come from people who go together and not entitled at all. So young people for a lot of things are looked at as not being entitled to do so. In a little, we already touched a bit on it, both Alex and myself. I by saying the hype on AI has to be surveyed a lot. We have to get the people on the table, on the making of, as Alex clearly said. For the moment being, it's in the hand of a happy few. You can see the happy few at the institution of President Trump or at the marriage in Venice. But this should not be the case. There are so many brains that can contribute. And I'm also, in terms of tech, hoping that other places will stand up and create it, because I don't see that they are integrated freely into existing algorithm producing tech companies. So the option would be to have other places, other teams creating systems that are then really open source and really open to knowledge of people from everywhere. That is my hope, and I think that the GDPR of the European Union is a small little step, but it is a little step, and we have to support these kind of movements or steps.
Yeah, echoing what Bettina was saying there, we definitely need better legal and political safeguards as to what tech is being used for. I think my sort of take home is sort of being nosy and being loud and being critical about tech, and not just taking it constantly at face value. I think we need to, as a society, question why we use tech so much, what we're using tech for. Is it to is it to form better human connections? Is it so that we as a society can work together and collaborate together and form tighter bonds? Or is it being used to push products? Is it being used to at the detriment of our health for someone else's profit? And I think we need to be critical of how we're using tech. Again, yeah, tech. I think I see tech as being a tool for, again, better communication. And I think we need to recognize that like different types of tech and different types of tools are used for different situations. And we need to be better at knowing which situation to use what tech for. Yeah, sorry, I kind of lost my point a little bit. But yeah, I think, again, sort of echoing what we've already said before, I think true equity in technology means we have to have diversity in all parts of the tech cycle, in the implementation, in the conceptualization, in the user monitoring, and all the feedback that we're getting from it as well. I think tech can be, as you said in the question, I think tech can be used to reduce inequalities. I think we've seen that with social media, where people who previously didn't necessarily have a voice in mainstream media are being given the opportunity to have a voice. And for good and for bad, I follow a lot of disabled and people living with disabilities on social media. And it's been absolutely amazing and fascinating getting such a personal and intimate look into lives of people that I don't relate to immediately, just because that's not a lived experience that I have. And I think it's amazing to have that intimacy of what another person is living through and the challenges that somebody lives through during their day. And I think when we use tech in that way to connect people and tech to humanize each other, I think that's hugely, hugely powerful. Having said that, though, I think tech can also be used to dehumanize others. And I think we've seen that, unfortunately, with anti-migrant sentiments, with and again, anti-immigration sentiments as well around the world, and with fueling all the genocides and everything that's been going on in the wars.
Yeah. I'd like to pick up on the word you used, Alex. It's a tool. It's AI, and the digital tools we have is a tool. And it always depends on who uses the tool and how the tool is used. The classical example of Alfred Nobel discovering dynamite. Some places in China used it always for fireworks and beautiful things, and others for the war. So it is a tool, and we as humans stay humans. Some will use it in an improper way, and others will use it to get more human, to get closer to people. And we have seen that already, and you mentioned some of these developments. It's a tool, and we have to take care of who uses the tool and how we use it. And that's it. It's not that AI will change our human relations, our human beings completely. So let us be very, very serious with this tool. It can do so much good as it can do so much bad.
I'd say at the end of this Congress, I want people to build strong networks. I want people to use this Congress as a place to share ideas, to build trust between ourselves, and to work together and to collaborate together for the common good and to, again, reduce inequities.
Thank you so much, Alex. It's really creating the togetherness that is the basis. And I hope that this Cape Town Congress will be able to do so. I think it will be. We have not yet thought of a call for action that we on most congresses create. If I would be asked for a call of action these days, I would ask the people a call to peace. We have now 110 armed conflicts around in the world, and there is no health with peace. There is no health for coming generations without peace. War is a generational problem, and we are creating and creating more of it. For me, for the moment, I would say a call for peace, just because the given political situation is what it is. But we have not yet discussed about the call to action. So let's be curious. I have my meeting with the International Conference Committee very soon.